So more recently, I've focused on obsessive-compulsive disorder, body dysmorphic disorder and anorexia. And a lot of this work is focused on providing greater access to care that is evidence-informed as well as personalised and has a holistic and biopsychosocial approach. And so a lot of these conditions are very severe in nature, and there is a treatment gap in terms of providing appropriate treatment for people at severe stages. And so my work tries to close this treatment gap and make sure that there is available treatments for these group of patients. My name is Nicola Acevedo and I'm a Neuroscientist and Research Fellow at Swinburne University. So I'm working on neurobiological and novel therapies for severe psychiatric illnesses. I also have a consulting business called Neurotech Insights, and we offer consulting and tutoring services. I have a number of committee positions in scientific committees. So I'm a director of a charity called BioAutism, and we raise money for autism research. And I'm also vice president of the Australasian Brain Stimulation Society. My biggest turning point would have been working with a mentor that truly believed in me and endorsed me and supported my decisions. I think that this created a lot of confidence and innovation in my work, and there were a lot of points where I didn't feel this way. I felt very inadequate and that I wasn't progressing and wasn't capable, and I think that it's very easy to sort of compare yourself to others that are a lot further ahead in their career, and so having someone that allowed me to realise my potential was really valuable to understand that I just needed some support and time and a little bit of grit to reach those goals. And so I think it's really valuable to have a mentor at any stage of your career. And so I think it also shows that mindset is really important. In terms of my education journey, I was always passionate about mental health, and I started working in the neurostimulation field after completing an honours in cognitive neuroscience. And so this was really valuable exposure to a technical field and a therapy that was able to directly modulate the underlying mechanisms of a disease. And so this sparked a big interest in neurostimulation. But I also knew I wanted to work in the mental health field. And so then I completed a PhD in deep brain stimulation for OCD. And so I think it was really valuable to gain that professional experience going into the PhD to understand what my research interests were and make sure that they aligned with my long-term goals. I'm an early career researcher, and a recent turning point for me was an award or a recognition for my work, and so this was the ability to present my work at a plenary at a conference called Biological Psychiatry Australia, and so that was really valuable to have that recognition and gave me a lot of confidence to continue working in this space. My research is focused on novel therapies for a range of neurological and psychiatric conditions. And so this has involved neurostimulation therapies and psychedelic therapies. And so more recently, I've focused on obsessive-compulsive disorder, body dysmorphic disorder and anorexia. And a lot of this work is focused on providing greater access to care that is evidence-informed as well as personalised and has a holistic and biopsychosocial approach. And so a lot of these conditions are very severe in nature, and there is a treatment gap in terms of providing appropriate treatment for people at severe stages. And so my work tries to close this treatment gap and make sure that there is available treatments for these group of patients. We have collaborated with a number of institutes, particularly Melbourne University, across our clinical trials here at Swinburne University. Some of the organisations that have funded our research include the Brain Research Fund through the Milken Institute. We've also received a philanthropic grant through a company called Perpetual, and a brain sciences grant through Barbara Dicker Foundation. I've always been really fascinated by the brain and had a passion for mental health. So ever since I started studying psychology, I knew I wanted to work in this field and work towards contributing to work that improved the outcomes and the life of people struggling with ill mental health. So I think that there can be a lot of progress made in this field in Australia. And then throughout my PhD, I worked with very severe people that often are left with a lack of treatment options, sort of cycling through the system and not being able to receive specialised care. So this really consolidated my passion to working towards providing greater access to care as well as personalised care and looking at a holistic and biopsychosocial approach. I really like to keep active outside of work, so I enjoy playing soccer, hiking or other fitness activities, also salsa dancing. I really enjoy traveling to new places and I do play the drums, and so going to music gigs is also a fun hobby of mine.